Hello, I'm Dr. Sanjay Panicker. I'm the founder of Amrita Homeopathy. We started the clinic in 1997 in a small town in Kerala. Today we have two clinics in Bangalore, in Marathali and at Korumangala. We specialize in hair and skin problems, respiratory problems, allergies, pediatrics, infertility, varicocele and PCOD. Excessive hair loss in women is most commonly seen in three stages in life. One is puberty, post-delivery and menopause. The hair loss which happens in these three stages is excessive and is from all the areas of the scalp. That if you touch the hair and just do this, you get 10-15 hairs, then actually you need not worry, because this condition is called telogen effluvium and it's a condition which is reversible. It comes, it makes you to lose a lot of hair. It lasts for 30 to 90 days and whatever you have lost during this period comes back. Whereas there is another type of hair loss which happens in women, and this is called androgenic alopecia. Androgen means male hormone. Androgenic means generated by the male hormone testosterone. A derivative of testosterone called dihydroxytestosterone causes certain type of hair loss. This is the difficult type of hair loss to treat. Here what happens is, there are certain receptors in the crown area of the scalp. These receptors get activated due to various reasons, and once it gets activated, the dihydroxytestosterone blocks the hair follicles, and so the nutrition what is supposed to reach the hair through the follicles will not be able to reach the hair. And if it doesn't reach the hair, what happens? A thick hair falls, a thinner hair grows, a thin hair falls, and even thinner hair grows, and eventually nothing grows at all. So there's a progressive thinning of the hair which happens in patients with alopecia, androgenic alopecia. So this type of alopecia means hair loss. Androgenic means generated by the male hormone testosterone. Women also have certain amount of testosterone, though estrogen is a predominant hormone. In women, after menopause, estrogen level goes down and androgenic alopecia becomes prominent. So people lose hair, the partition gets wider. It happens in a particular pattern where the partition keeps getting wider. But if this is happening in a younger age, this is a premature thinning of the hair which has to happen at 50 years or after some particular age of menopause, is happening much earlier. So premature aging of the hair, this is difficult to treat. We know that in medical science, aging is irreversible, death is irreversible. If I die, I cannot come back to life. If I become old, I cannot become young. The same rule applies to the hair also. The hair which has become thin cannot become thick again. So a particular stage, there are three stages in the life of a hair: a stage of growing phase, a maintaining phase and a falling phase. And if these phases are happening in a particular fashion and it is growing back, whatever is falling is growing back, it's fine. But if it's growing back as a thinner hair, then it is a problem which needs to be addressed. There are different reasons for this. It can be because of genetic factors, but genetic factors gets activated as the age becomes 50 years or plus. So any hair loss which happens much younger, in a younger age like 30 years, 20 years and 40 years should not be attributed to the gene. Could be other reasons for it. Maybe bad water, maybe bad shampoo, maybe the products that you're applying on the hair is not right, maybe oil is not right. And it could also be because of hormonal factors, like most commonly in women, PCOD, polycystic ovaries, is one of the trigger for androgenic alopecia. Thyroid problem is again one of the trigger. Whenever you have thyroid, you have a high tendency for your cholesterol to go high and your PCOD to develop subsequently, because you tend to put on weight, and when you put on weight, PCOD comes. It's like a vicious cycle. And when cysts are there in the ovaries, the cyst only secretes testosterone and the skin becomes sensitive to testosterone. Already for a patient with androgenic alopecia, skin is sensitive, and if skin is sensitive to testosterone, the testosterone blocks the root of the hair. Not that testosterone level is high, but your skin is sensitive to testosterone, and that's what is causing the problem. So again, you have factors like habits, like smoking is one of the trigger which can cause androgenic alopecia. People who have used medicines like minoxidil and finasteride can have an improvement when they're using it, but when they stop it, it causes excessive hair loss. This is one of the withdrawal effects of minoxidil. And finasteride is not very safe in pregnant women, so it's not advised during pregnancy. So these medicines can improve at that moment, but afterwards it causes a withdrawal hair loss. Even anti-epileptic medicines can cause hair loss. So these are the different reasons why women can have hair loss. and we can manage it well with homeopathic medicines and see that it doesn't age so prematurely. We can postpone it till your old age, but in old age it will happen. Whereas telogen effluvium is a hair loss which can be managed with just general management, maybe a little bit of medicines, and you can stabilize it within 30 to 90 days, and it grows back also. You see, women lose hair after delivery, but after some time, 3 or 4 months or 4 or 5 months, it again grows back. So that condition we need not worry, but androgenic alopecia is to be taken care of.